You are not going to believe this comeback story we've got for you today. It's from the world of medicine, and it's all about a drug that's literally been around for centuries. A drug that everyone kind of forgot about. And now, well, now it might just be a total game changer for treating heart failure.
So here's the big question, right? Could a drug that modern medicine basically left behind, could it actually be the answer for some of the sickest heart failure patients today? I mean, this is a story that has been over 200 years in the making. Let's dive in.
All right, to really get what's going on here, we've got to hop in the time machine for a second. Because we're not talking about some brand new, shiny molecule cooked up in a high-tech lab. Nope, this is about an ancient remedy being seen through a totally modern lens.
So the history of this stuff is, well, it's long. We're talking way back in 1785, with a beautiful but potent foxglove plant. A doctor named William Withering noticed it was being used to treat something called dropsy, which we now know is fluid retention from heart failure. By the 1930s, scientists had isolated the active ingredients, digoxin and digitoxin. But then, fast forward to 1997, a huge trial called the DIG trial came out with some, let's say, mixed results for digoxin, and its use started to drop off a cliff. And that right there sets the stage for what just happened with its sibling drug, Digitoxin.
So, what do these things actually do? Well, in simple terms, cardiac glycosides give a weak heart a little extra oomph to help it pump more strongly. They can also help get an irregular heartbeat back into a normal rhythm. For a very, very long time, these are one of the main tools in the toolbox for heart failure.
Okay, so that leads to a pretty obvious question, right? If these drugs were a go-to treatment for so long, what happened? Why did they just fall off the map?
Well, it turns out there were a few really big problems. First, and this is a big one, there were some serious concerns about toxicity. You see, these drugs have what's called a narrow therapeutic window. That's just a fancy way of saying the line between a dose that helps you and a dose that hurts you is razor thin. On top of that, they didn't play well with other common meds, and, this was the real nail in the coffin, a whole bunch of newer, safer, and better therapies came along.
But wait, this story doesn't end there. Not even close. See, one member of this old drug family, Digitoxin, was a little different. It's kind of like finding an old, forgotten tool in the back of the garage that turns out to be absolutely perfect for a very specific modern job. And that unique quality is what's got scientists really excited again. And this, right here, is the absolute game changer. The more famous cousin, digoxin, gets cleared out of your body by your kidneys. That's a huge problem, because a lot of people with heart failure also have kidney problems. But digitoxin, it's cleared by the liver. And that means its levels in the body stay nice and stable, predictable, even if a patient's kidneys are struggling. This makes it a potentially way safer choice for a lot of people.
So with this amazing property in mind, scientists decided it was time. It was time to put this old drug to the ultimate modern test. They wanted to know, could this forgotten remedy actually hold its own against the very best treatments we have in our arsenal today?
And that's exactly what the DIGIT-HF trial set out to do. The goal wasn't to throw out all our new, amazing treatments. No way. It was to ask, could this old-timer actually add something valuable on top of everything else we're already doing? It was time to see if this old remedy could pass a very modern test.
And let me tell you, this was no small-time study. We're talking the gold standard of medical research, double-blind, randomized, placebo-controlled. That means neither the patients nor the doctors knew who was getting the real drug. They enrolled over 1,200 patients and followed them for 3 years, pitting low-dose digitoxin against a simple placebo.
Now, this is what makes the results so incredible. These weren't patients who were getting no treatment, not at all. These folks were already getting top-of-the-line modern care. Almost all of them were on the best medications we have, and nearly 2/3 of them had an implantable defibrillator. So any benefit from digitoxin had to be on top of all that great treatment. The bar was set incredibly high.
All right, so after years of waiting, years of collecting data, the results were in. The old drug went up against the new standard. So, what happened? The headline number? A whopping 18%. An 18% relative risk reduction. That is a really big deal. It means the patients taking digitoxin were 18% less likely to experience the main bad outcome the trial was looking for compared to the patients taking a sugar pill.
Let's break down what that 18% actually looks like. In the group that got the placebo, the fake pill, about 44% of them either died or had to be hospitalized for their heart failure. But in the digitoxin group, that number dropped down to under 40%, a clear, meaningful improvement. Okay, so what were they actually measuring here? It's what scientists call a primary outcome. And in this case, it was a combination, a composite of the two things that matter most to patients and doctors: death from any cause, or getting so sick from heart failure that you end up in the hospital.
Let me put that in a way that's even easier to grasp. It's something called the number needed to treat. For this study, it was 22. That means you only needed to treat 22 patients with Digitoxin to prevent one of those major events, one death or one hospitalization. In the world of medicine, that is a really impressive number.
Okay, so we have this amazing comeback story. What does it all mean for doctors and for the millions of people living with heart failure in the real world right now? And this is the crucial part. Nobody is saying we should throw out our fantastic modern therapies. Not at all. Think of it like this. Heart failure treatment already has 4-star players on the team. This study shows that Digitoxin can be a valuable 5th player, working right alongside them.
And hey, don't just take my word for it. The lead scientist on the trial, Dr. Udo Bovendijk, put it perfectly. He said Digitoxin is a new option for patients with HFrEF. That's just a type of heart failure where the heart's main pumping chamber is weak. And he specifically called out those patients who might benefit the most, including those with, you guessed it, impaired kidney function. So, let's wrap this incredible story up. Step 1. A drug that's been around for over 200 years was put through the ringer in a tough, modern trial. Step 2. It passed with flying colors, significantly cutting the risk of death or hospitalization for patients who are already getting great care. And Step 3. It gives doctors a brand new, or, well, old new, safe and effective tool to add to their toolkit.
You know, this whole trial, it looked to the past to find a way to move medicine forward. And it just makes you wonder, doesn't it? What other old, forgotten medicines are just sitting on the shelf, waiting for their own comeback story?